All right, everyone. Thank you so much for joining me. My name is Dr. Alexandra Richard, and I am here to do the NCLEX review for maternity with you. So, we're just going to do a brief overview of the anatomy and physiology just because it makes understanding maternity easier when you understand the parts that are involved. So, the basic anatomy of the female reproductive system, making sure we understand that this is the uterus, this is where the baby's going to grow, okay? And this is the vagina. So, the vagina is where the semen will be ejaculated, and the sperm will swim up the vagina and pass the opening that separates the uterus from the vagina is called the cervix. So make sure you know that. So the cervix is going to be very important later on for labor and delivery when we're learning that the cervix is going to have to dilate, which means open, and efface, which means to get thinner. So the sperm swim up the vagina, enter the cervix, and through the uterus, and the sperm have to make a very important decision whether they're going to go left or right. And each month, the woman's ovary is going to release one egg on one side. And so the sperm have to make the right decision. And so that is what makes the process of conception and birth so beautiful. So it looks like I've been signed out. Just give me one moment to get this fixed and we'll get right back on track. Well, so when we do a cervical exam, I know, right? It's so hard to believe. A doctor told me that one time, and I was like, no, there's no way it looks like a hot dog. But so as we can see here, they're doing a cervical exam, and they're using a cervical brush um, to get tissue samples from the cervix, maybe for a pap smear. Okay. And so what it looks like when you insert the speculum into a vagina, this is what the cervix looks like. So it looks like a hot dog. That's so crazy, right? All right. The other thing I want you to know is there's four different types of pelvises. So the pelvic shape that is ideal for giving birth is called the gynecoid pelvis. Then we have the male reproductive system. So we have the penis, we have the testicles, which are filled with the scrotum, which are filled with, you have the male has two testicles, okay? There's the epididymis, the vas deferens, here's the bladder, the prostate gland wraps around the urethra. That, we learned about prostate cancer and we learned about benign prostatic hypertrophy, BPH. And so we learned that usually when men have issues with their prostate, that they also have issues with their urine flow, and it's because the prostate wraps around the urethra. Okay. So the order of development of the baby, it's going to be first zygote, then embryo, then fetus, and then when they're born, they are called a newborn. And a newborn is from when they're first born to their first month of life. Zygote, embryo, fetus, and then newborn up to 1 month. Next up, I want you to know what a teratogen is. A teratogen is any agent that could lead to defects or death of the fetus. So the top four I want you to know for NCLEX are alcohol, tobacco, drugs, and any kind of toxin or chemical. All right. Also, I want you to write this down. So there's something very specific about weeks 1 through 4 of pregnancy. So weeks 1 through 4 is a very sensitive and fragile time for the fetus. It is a time where the risk of miscarriage is high due to teratogen exposure. A major cause of miscarriage early on in pregnancy is chromosomal abnormalities. So please make sure you know that. So just jot that down. All right. So the fetal environment. So I want you to know the chorion, which is the outer membrane, the amnion, which encases the baby and it's filled with amniotic fluid. Here we have the baby, okay, and it resides in the uterus. The placenta attaches to the uterine wall, and so that is how nutrients and oxygen from mommy they enter into the placental blood vessels and go through the umbilical cord, and then nutrients and oxygen get to baby, and then CO2 and waste products from the baby go back through the umbilical cord into the placenta and then out to mommy so that mommy's body can get rid of the waste products. It's a beautiful transaction. So I want you to know that amniotic fluid is a way to measure fetal, renal, and lung function. Okay, so make sure you understand that amniotic fluid it provides very valuable information. It helps the fetal lungs develop and opens their alveoli. And too much amniotic fluid is called polyhydramnios, and not enough is called oligohydramnios. All right. So here is a precious picture. I love this picture so much, just to kind of show you the beauty of life. And I love this picture very much. All right, next up, I want you to know AVA for the umbilical cord. AVA stands for artery, vein, artery. So it's very important that when the baby is born and the umbilical cord is cut, you always want to count the vessels and you always want to see three. So if you don't see three vessels, you want to alert the healthcare provider immediately because it could have indicated that the baby underwent some type of intrauterine growth restriction because they were not receiving adequate blood supply. So just remember you should have three vessels: AVA, artery, vein, artery. Okay. So this is just an example, a diagram showing how the surgeon will clamp and cut the umbilical cord. And so they'll use two clamps and cut in the center. And you want to see three vessels: artery, vein, artery. And so how many vessels do you see in this picture? Yeah. And so what would you do? Exactly. Well, the doctor or the healthcare provider is probably gonna be there because we're cutting the umbilical cord after the baby's born. But hey, things happen. Sometimes babies are born before the healthcare provider gets there, right? But just knowing that you want to see three vessels. Next up, we're going to learn Nagel's rule. So, Nagel's rule is a way to determine the estimated date of delivery. Can anybody let me know what is the estimated date of delivery? Okay, so write this down and then let's talk about it. All right, so the estimated date of delivery is the approximate date the baby will be born. So the formula is you take the first day of mommy's last menstrual period. So you're going to ask her, like, let's say you ask me, well, I want to be professional, so this is just for learning. Okay, so let's say I was your patient and you asked me, well, when was your last period? And I say, well, it started on Monday. So that means because it started on Monday, Monday was the first day of my last menstrual period. Does that make sense? So we would take Monday, right? And we would subtract 3 months and add 7 days. So what day was Monday? Monday was February 9th. So the first day of my last menstrual period was February 9th, right? So what we're going to do is we're going to subtract 3 months. So that means we're going to subtract January, December, November, okay? And then we're going to add 7 days. Okay, and we're gonna practice because I know it's a little tricky, especially when it's a February month because yeah, it's a little tricky. But so basically, what you do is to figure out when mommy is probably gonna give birth. You subtract 3 months and you add 7 days. Does anybody have any questions about this before we start the practice questions? And so because we're estimated when we're basically estimating when is she going to give birth. So it's always going to be a year, like it's always going to be forward. So because it's like November is going to happen this year, it's 2026. Okay, so let's practice. Okay, so the nurse is caring for a patient that just found out she is 4 weeks pregnant. The patient asked the nurse when can she expect to deliver the baby. The patient's last menstrual period started on May 12th. Which of the following is the correct estimated date of delivery? Okay, put your answers in the chat. Okay, so February 19th. Very good. So how did you do it? So the first day of the last menstrual period was May 12th. So first you're going to subtract 3 months. So May is month 5. So we're going to go 5 minus 3, which is 2, which gives us February. And then you add 7 days, which will give you February 19th. All right. The patient's last menstrual period started on January 3rd. Which of the following is the correct estimated date of delivery? All right, very good. October 10th. Excellent. So the patient's last menstrual period started January 3rd. So we need to subtract 3 months. Hold on. So we need to subtract 3 months. So we're going to go December, November, October. And then we're going to add 7 days, and that's how we'll get October 10th. All right, one more practice question. Wonderful, wonderful work. Excellent. So the first day of the last menstrual period was July 20th. So we're going to track 3 months, which will give us April. And then we're going to add 7 days, which will give us April 27th. All right, guys, wonderful. So now we're going to learn some important terms. We're going to talk about GTPAL, okay? But first, I want to talk about some timelines that I want you to establish, okay? And I really want you to work on understanding these so that you can answer GTPAL questions correctly. So I want you to know what the fetus is categorized as depending on when they're delivered. So if the fetus is delivered between 0 and 20 weeks, we call that a miscarriage or abortion. If the fetus is delivered between 20 but before 37 weeks, we call that preterm or premature. And 37 weeks up, we call that term. So take a moment and write that down, and then we will get back into lecture. All right. So we're on page 327 in the study guide. So GTPAL, it's basically a quick way to give a woman's obstetric history. And so you have to know what these words are, or these terms mean, excuse me. So again, we're on page 327, so make sure that you study this. Gravida, it means that she's pregnant. Gravity refers to the number of pregnancies. So when we're talking about GTPAL, the G is how many times she's been pregnant, including this current pregnancy. So if it says her G is 4, tell me what that means in the chat. If a question says G4 for gravity, very good. It means her fourth pregnancy, but it means that she was pregnant 3 times before and she's pregnant now. Cool? Okay. If it says nulli gravida, she's never been pregnant. Primigravida, this is her first time being pregnant. Multigravida, this is at least her second pregnancy. Parity is the number of births carried past 20 weeks, regardless if the baby was born alive. So just that's what it means. Parity, she carried the baby like she had a birth after 20 weeks. And so GTPAL, gravity, is the number of pregnancies, including the current one. T is term births, which is the number of births after 37 weeks. Okay. And then preterm. Preterm, we're just going to make a slight change here and just do it with me in your study guide or on your notes. So term, I'm sorry, preterm. Okay. So for preterm, we're going to say preterms is the number of babies born after 20 weeks but before 37. Okay, abortions, it's going to tell you how many abortions or miscarriages that she's had, and then the L is how many living children. Okay, and so also keep in mind that if she's pregnant with twins, that's one pregnancy. So let's say she's pregnant right now and she has twins, and this is her first pregnancy. So what would her G be? If she's pregnant right now and this is her first pregnancy, what would her G be? Very good. Her G would be 1 because she's pregnant right now and it's her first time, right? And let's say she has twins and she gives birth to the twins and now they're both living. So what would her L be? 2. You see, you've got it. All right. You guys are very wonderful. Excellent. All right. So now let's do some GTPAL practice. Okay. A woman is 12 weeks pregnant. She had a miscarriage at 8 weeks gestation. She has a 3-year-old born at 39 weeks. What is her GTPAL? So I'll give you a moment. Do it on your own and then we'll do it together. Okay, so did you send your answers in the chat? I didn't see anybody put any answers. All right. So only one person answer. Okay, two. Okay, all right. So let's talk about it. So a woman is 12 weeks pregnant. She had a miscarriage at 8 weeks, and she has a 3-year-old born at 39 weeks. What is her GTPAL? So the easiest part is to go through and see how many times she's been pregnant, because that's the G. So she's 12 weeks pregnant. That makes G1. She had a miscarriage at 8 weeks, so that was G2. And then she has a 3-year-old, so that was G3. Okay. And then term is the baby's born 37 weeks plus. So she's 12 weeks pregnant, so that baby hasn't been born yet. The miscarriage at 8 weeks unfortunately didn't make it to term. And then she has a 3-year-old that was born at 39 weeks, so that was past 37. So that makes term births 1. Okay, preterms are babies born after 20 weeks but before 37. So she's 12 weeks pregnant. That baby hasn't been born yet. The miscarriage at 8, they unfortunately didn't make it to the 20 to 37 week. And then the 39, that was after. So preterms is 0. Abortions, miscarriages, it says here she had a miscarriage at 8 weeks, so that makes abortion miscarriage 1. And then it says she has a 3-year-old, so that makes the living 1. Does that make sense to everyone? All right, let's practice another. So, a 28-year-old woman is 24 weeks pregnant with twins. She had 4 children born at 38 weeks gestation. She had one child born at 28 weeks gestation. She has 5 living children. What is her GTPAL? So, I'm going to give you a couple minutes and we'll do it together.
Imagine being able to build an app.
Put your answers in the chat. All right, so only one person put the answer in the chat. Okay, so this one is tricky. All right, so 64105. So almost there. But this is the tricky one. Okay, so a 28-year-old woman is 24 weeks pregnant with twins. She had four children born 38 weeks gestation. She had one child born at 28 weeks gestation. She has five living children. So what is her GTPAL? So she's 24 weeks pregnant. So that's G1. The four children, that's make 1 plus 4, that makes it 5. And then she had one child born at 28 weeks, so that makes G6. Okay. And then term means the baby was born after 37 weeks. So she's 24 weeks pregnant now, so that's not term yet. The babies weren't born yet. The four that were born at 38 weeks, so that makes T4. And then one child born at 28 weeks, that's too early. So the T is 4. For the term babies born after 37 weeks, that's 4. Okay. Preterm are babies born after 20 weeks but before 37 weeks. So that would be the one child she had born at 28 weeks. So preterm is 1. And then the question doesn't say anything about abortions or miscarriages. And then the question says she has five living children, so L is 5. All right, one more GTPAL practice. Here you go, and then we'll do it together. All right, very good. So it's T0010. Very good. So a 19-year-old woman is 10 weeks pregnant. So that's G1. She had a miscarriage at 13 weeks gestation. So that's G2. Okay. And then term births are 37 weeks and up. So she's pregnant. She's 10 weeks pregnant. So that baby wasn't born yet. And she had a miscarriage at 13 weeks. So unfortunately, that baby didn't make it to 37, so T is 0. And then preterm is for babies born before 20 weeks. I'm sorry, preterm is babies born between 20 weeks and before 37 weeks. So this 10 weeks is no, 13 weeks no. So preterm is between 20 weeks and before 37 weeks. And then abortions, miscarriages. So she had one miscarriage at 13 weeks, and then it says she has no living children. Okay. All right, guys. So now let's see where we're headed to next. So we're going to learn about the positive, the presumptive, the probable, and positive signs of pregnancy. It's very simple. Excuse me. So we're still on page 237 in the study guide. So presumptive, probable, and positive. So just write down that Positive pregnancy signs are the only way to say that a woman is pregnant or that someone is pregnant. The only way. Okay. So presumptive means like maybe she's pregnant. We can kind of assume that maybe she's pregnant. Probable pregnancy signs mean she's probably pregnant. But the only way to say this woman or this person is pregnant is a positive pregnancy sign. So presumptives include like missing her period, which is amenorrhea, nausea, vomiting, fullness of the breasts. Okay, probable signs, which means she's probably pregnant. Signs like Braxton Hicks contractions, which are kind of like contractions that can simulate labor, but they're not true labor contractions. Goodall sign, which is a softening of the cervix. Chadwick sign, which is when the cervix turns blue. So those are signs that or even like a positive pregnancy test. So make sure you know that a positive pregnancy test, that's a probable sign of pregnancy. But the ways to say that this woman absolutely or this person is absolutely pregnant is you hear the fetal heart rate, you as the examiner feel the baby moving, or we see the baby on ultrasound. So those are the only ways to say that she's pregnant. All right. So next we're going to talk about the changes that a pregnant woman's body goes through. So first up is cardiac changes. Make sure you know that pregnancy is going to cause an increase in fluid volume in the pregnant woman's body. So this is going to lead to a couple of issues. So first up, this increase in fluid volume is going to cause something called physiological anemia, where there's more fluid in the body and it makes it look like there's not enough red blood cells. And it's going to drop her iron through hemodilution. So that's why pregnant women need to increase their iron intake, because you need iron to make hemoglobin. And so that's how we can overcome that physiological anemia that is induced by pregnancy. Next up is this increase in fluid volume is also going to lead to shortness of breath. All right. Next up is so just knowing that women need to have adequate iron and folic acid. So, iron is going to help with the anemia. Folic acid is going to prevent neural tube defects like spina bifida. And you can get iron and folic acid from green leafy vegetables. So, let's look at the non pregnant body versus the pregnant body. So, here's the heart. So we can see that in the pregnant woman, the heart enlarges, the heart becomes larger. Okay, and so that also leads to issues with shortness of breath and just like congestion. Also, if we look at the shape of the lungs kind of get smushed up. So as we can see, the baby, as the uterus enlarges, it pushes the organs up and the organs kind of push the diaphragm up and it flattens the lungs out. So because it flattens the lungs out, the lungs don't have as much room to expand as they normally would. And so that's why not only from the increased fluid, but also from the movement of the organs pressing up against the diaphragm, flattening out the lungs, that also leads to shortness of breath in pregnancy. We can see the milk ducts here compared to here are much larger. Baby's about to come out, and this is going to be his food supply. Also, we can see the liver gets smushed. This is the stomach in a non-pregnant woman. This is the stomach, the gravid stomach. So as we can see, baby's pushing up on the stomach. So what kind of symptoms do you believe that this would contribute to? So we're talking about the stomach. So do you think that when she, like, okay, in a normal stomach, when our stomach has its normal space to expand and grow, food is going to move through there properly. Do you think that the stomach being smushed like this, do you think that maybe it's going to take longer for food to get out of the stomach? And do you think that that could maybe lead to heartburn? What about indigestion? Okay. And then also look at the intestines. So the intestines here, spaced out. They've got their room, but here baby is smushing the intestines up. So do you think that this is going to make food move slower through the GI tract because now everything's all smushed, right? So do you think that in addition to hormones, that this could lead to constipation, right? So those kind of like GI symptoms of pregnancy, you know, are due to decreased gastric motility because the organs are smushed and compressed. And so food and digestive contents aren't going to move through the GI tract as they normally would. And so that leads to heartburn, indigestion, nausea, upset stomach, constipation, and also the hormones of pregnancy decrease gastric motility and lead to constipation and nausea as well. Okay. And then also, let's look at the bladder. Let's see. So here's the uterus that's not pregnant. Okay. That's that. And then look how big the uterus becomes. It's amazing, right? It can grow to the size of a large watermelon. So that's why we don't want the egg to stay in the fallopian tube. The fallopian tube cannot expand like this. Okay. The uterus is so amazing. It's going to get this big, and then when the baby comes out, it's going to get right back. It's going to get small. It's amazing. So look at the urinary bladder. So here's the bladder here. Okay, and then look at the bladder here. So what happens to the bladder during pregnancy? Yeah, look at this bladder, and then look at this. So she doesn't, it, the uterus compresses on the bladder. And so it decreases how much space or room is available for urine. So, does it make sense why pregnant women have to pee all the time? Because the baby's pressing on the bladder. Okay. And the more she's peeing, the more there's a risk for UTI, right? So, that's also why pregnant women can get UTIs. And then also, let's look at her spinal column. So, here it's at a normal angle. What happens here to the lumbar sacral angle? It kind of becomes sharper, right? So here it's more curvy. And do you see how here it kind of becomes sharper right here? So pregnancy is going to cause a change in the spine called lordosis, which it causes her to kind of poke her belly forward. And so that's that signature walk of when the pregnant woman's walking, her hands are, you know, behind her hips and her belly's poking out. So that's associated with that. So a lot of changes happen in the pregnant woman's body. So important nutrition, they need adequate iron and folic acid intake from green leafy vegetables. They need good protein because they're growing another individual. Pregnant women need to take their prenatal vitamin with folic acid daily, and they need about 1,800 to 2,400 calories a day. Pregnant women should drink 8 to 12 cups of water a day so that we don't want to cause dehydration. Dehydration in the pregnant woman is going to lead to dizziness and uterine contractions. Okay. Also, dehydration can lead to constipation and hemorrhoids. So we want to decrease the risk for constipation and hemorrhoids. So we want mommy drinking water. It's also going to help reduce the risk of UTI. So just keep in mind that we want mommy to be adequately hydrated because dehydration can lead to contractions, dizziness, constipation, hemorrhoids, and UTI. Some other changes associated with pregnancy, linea nigra. This is due to the pregnancy hormones, and this line of pigmentation usually goes away after birth. There's nothing wrong, it's not a big deal. I had it, and yep, it does go away after birth. Chloasma, which is called the mask of pregnancy. It is a hyperpigmentation on the face, and it is due to pregnancy hormones, and it usually goes away after birth. So that's what we want to let the patients know. If they're sad or nervous about it, it usually goes away after birth. Next up is striae gravidarum. These are red-purple stretch marks, and they usually go away after birth. Now, these are a little, more controversial, but usually they go away after birth or they decrease in appearance after birth. Finally, a change in center of gravity. So remember I told you that pregnant women, as the belly grows, so their belly is sticking out, and so their spine kind of moves in a little bit at that angle. And so instead of the center of gravity being here, straight down the pelvis, the center of gravity moves forward as the belly grows. So this represents your center of gravity, non-pregnant. Pregnancy pushes the center of gravity forward, so that increases the risk for falls. Okay. All right, guys. So that's it for today. What I'm going to do is I'm going to send you this recording and I'm going to send you some practice questions. And when we meet back next week, we're going to do the top 10 topics on NCLEX for OB. So I just wanted to give you like an introduction to it. And then when we get back next week, we're going to learn about fetal heart rate patterns, gestational hypertension, preeclampsia and eclampsia, placenta previa versus abruptio placentae, and we're going to learn about postpartum hemorrhage, the stages of labor, and how to provide newborn education to mommy and daddy. So thank you so much. I will see you next week, and I will send this recording with some practice questions as soon as the recording is done. Thank you so much.